Hi, my name is Dr. Eric Bengel, and I'm a doctor of chiropractic in the Pittsburgh area. I graduated from Palmer College of Chiropractic nearly 30 years ago, and it's sad to say, but when I graduated and started in practice, we didn't even have computers. So I've basically self-taught myself how to program and use computers over the years. About a year ago, our office made the leap to electronic notes and updated our billing software. What's really nice about ChiroTouch is that the learning curve to use the software is basically non-existent. In the first days of having the software, we were doing notes and billing out. The support staff have been excellent, allowing us to change from our old billing software to ChiroTouch without any downtime. So basically, we stopped using our old software on a Friday and began billing out as ChiroTouch on a Monday. One of my worries, though, was that there would be a delay time or lag in us being paid from our carriers. Well, I'm happy to say that that wasn't the case. Our billing was seamless from one week to the next. When we made the change, we had been using our old software for about 12 years. So I really did my homework, as I didn't want to have to make the change twice. Well, I can affirm that we made the very best of decisions. ChiroTouch has been great for our staff to use as well. One of the features that we really like about the software is the scheduler. It makes it so easy for my staff to make or change appointments. They learn the software in about a week, and at this point in time, I could pretty much say that they're pros. We haven't looked back. We've been using the software for about a year now, and everything's been going really well with the software. Another feature that I like with the software is the ability to customize in the documentation section. We use a lot of proprietary forms for our patients, such as functional capacity exams, and I didn't want to not be able to use these forms anymore. So we were basically able to take those forms that were on paper, create them electronically, and now we use them as part of our software. It makes our documentation really fast and bulletproof, basically. One of the worries we also have is with audits and with our doctors doing their notes in ChiroTouch. Right now we have a medical doctor, 2 nurses, and 2 chiropractors in our practice. We really feel like our documentation is solid because ChiroTouch, it makes it so easy to document, makes it easy to make the documentation that is good and that is would be able to support an audit. Lastly, one of the great features I really like about the software is the fact that the software backs up automatically every night. Basically, I get an email around 9 or 10 o'clock at night saying that the software is backed up, and I don't have to worry that if there was a crash in our software system that would lose our data. We know that it's secure. So if you're looking for a billing software and a documentation software, I can wholeheartedly recommend ChiroTouch to you. I think it's a great software. I've used different programs over the years. We actually had started using billing electronic claims about 5 or 6 years ago, and it got so cumbersome and slow that we basically had to stop using the system. And then we went back to ChiroTouch here a year ago with the electronic note formats. We found that it was really, really easy to use. So I encourage you to make the decision to at least talk to somebody about purchasing the software. You'd be very happy with the software. I can attest to that. Thanks for your time and have a very healthy day.